Hello, everyone, and welcome. Thank you so much for joining us. We're going to give it maybe about another minute or two to just welcome folks into the room. And I'm also going to ask one of my team members to double check that we're able to see the captions. I'm not seeing them on my end. Thank you all. Hello, everyone, and welcome. We're going to get started in just another second or so. Just want to make sure folks are able to join us and access the Zoom room. Hey. So we're going to go ahead and get started. I first want to start by saying welcome and thank you for joining us for this year's Virtual Visiting Scholar webinar series. I'm Stephanie Page, co-PI of the ARC Network and Director of Strategic Initiatives for our home organization, WePan. Today, we are hosting the second member of the fifth cohort of Virtual Visiting Scholars. This program empowers scholars to complete metasyntheses and meta-analyses of existing literature to address critical issues relevant to equity in STEM. Before we introduce today's guest, I would like to take care of a few housekeeping items and provide a brief overview of the ARC network. I do want to let you know that this webinar is being recorded, and we will share the recording with registrants and post it to our ARC network website. First, live captioning is available through Zoom. If you hover your mouse over the bottom of the Zoom window, you will see a number of different menu options. To the right is the icon for captioning. Selecting the caret will allow you to customize your captioning. In the center are options for Q&A and chat. For the beginning of our webinar, you will only be able to view chat messages from the ARC team. We will also use the chat to share links for resources, other information, and any other additional opportunities that we'll discuss as we close today. We will open the chat for participants once our speaker finishes with their presentation. And if you have questions for the speaker, please add them to the Q&A where you can also upvote questions. To provide a little bit of background on the ARC Network, for those of us who might not have heard this before, the goal of the ARC Network is to create and cultivate a broad community that bridges the gap between researchers and practitioners. As the STEM Equity Brain Trust, the ARC Network works to promote systemic change by collecting previous work and producing new perspectives, methods, and interventions through convenings, a curated resource library, emergent research workshops, a virtual visiting scholars program, and online events like this one. The ARC network is built on and works through a framework integrating inclusion, intersectionality, and intentionality. We strive to ensure that our work accounts for the social stratifications that intertwine to determine the unique inequities that folk experience. The ARC network is funded through a cooperative agreement with the NSF Advanced Program and our home organization, the Women in Engineering Proactive Network, or WEPAN. To learn more about ARC Network, we encourage you to visit equityandstem.org, where you can also join the community if you haven't already. You can also find us on LinkedIn, Facebook, and Twitter at ARC Equity and STEM and hashtag Equity and STEM. But now, for the reason we are coming together today. It is my honor to introduce Dr. Erin Wintroud to share her work as the member of the fifth Virtual Visiting Scholar cohort. Dr. Wintroud is an associate professor of psychology and director of the Women's and Gender Studies program at Regis University, a Jesuit university in Denver, Colorado. Dr. Wintroud earned her BA in psychology from Willamette University and a PhD in counseling psychology with a graduate certificate in women's studies from Colorado State University. Her research focuses on access and inequity in academic STEM, with studies grounded in local women's experiences. She is particularly interested in utilizing her clinical training to bridge research and practice, hosting workshops and facilitating interventions designed to change institutional and cultural factors that are barriers to success. We will now shift screen sharing to our guest. Thank you for joining us, Erin.
Okay. Thank you so much, Stephanie, and just let me know, anybody, if you can't hear me. I think we're good now to see. I just want to start by thanking the ARC Network Research Board for the opportunity to do this project, and to Stephanie and the rest of the team for hosting me today. My name is Dr. Erin Wintroad, she, her pronouns, and just like Stephanie said, I am at Regis University in Denver, Colorado. I'm a counseling psychologist here, and I also direct the Women and Gender Studies program. And I just want to direct you to the ARC Network website for a full list of the references that we're going to be talking about today. Some of the figures that I'll show you will all be on there. Right before we started the webinar, there was a comment about maybe getting a little bit emotional in thinking about academic motherhood. And I just want to say that, of course, the personal is political. Political is personal as it is. And certainly motherhood is true for me too. I will give you a little sneak peek at my child, picture of my child at the very end of the presentation. But I know that this topic is personal for so many of us. So the title of my project is Academic Motherhood, a Mixed Method Review of the Child Penalty for Women of Color as STEM. One factor that deters junior scientists, so I'm thinking like graduate students, from pursuing careers in academia is this perception that women in science and engineering must somehow compromise family or make a compromise between family and career goals. Graduate students, particularly heterosexual women and across race and ethnicity, state that they believe they can either start a family or be a successful scientist, but not both. And historically, this may have been the case, but I was wondering if this is still the case now. We've known for years that parenting women face an ivory ceiling, or a black ceiling, lavender ceiling, concrete ceilings, lots of ceilings that women face due to a multitude of intersecting identities. And these findings are sometimes intensified for women in traditional or lab-based sciences, since science is rarely forgiving to interruptions or temporary leaves, and it might be difficult for women to find support for lab time when children are young. We know less about the experiences of mother scholars and how the experiences of mother scholars might vary by race or ethnicity. So most researchers who study the baby gap or the child penalty in academia do not include race ethnicity as a variable, or maybe it's included as a control variable only, sometimes dichotomizing participants into white and non-white categories. And most studies of the barriers facing academic women of color do not include information about parenting or other care responsibilities. And this is despite BIPOC women being much more likely to have additional care responsibilities beyond children compared to white women and compared to men across race and ethnicity. And we really don't know if this parenting penalty has continued. It's possible that the well-documented disparities of the past have led to enough policy changes that parenting women maybe are no longer penalized compared to parenting men. So in other words, maybe there's no gender bias in parenting anymore, or perhaps parenting women are no longer penalized compared to non-parenting women, so that there is no child penalty. It might also be possible that parenting penalties continue to exist for BIPOC women, but not for white women in the academy, and that we may be missing that depending on the way we aggregate or disaggregate our samples. Or it might have been possible that the child penalty has been decreasing in the last couple of decades up until the pandemic, when we saw female scientists, particularly BIPOC women, and those with young children, facing all kinds of increased childcare and household responsibilities. So these are the questions that I'm interested in asking. I've been looking at the literature on the impact of academic motherhood on success as a scientist from the last decade, including through the work from home pandemic years. So I chose a start date of 2010 because there were multiple summaries of previous literature published around that time. I'm thinking like Mason and colleagues, 2013. And gender disparities in the academy were well established prior to 2010. Some programs and policy changes were already implemented prior to 2010, and certainly since 2010. So my thought was that we should see a reduction in the negative impact of academic motherhood in the past decade if these policies were implemented and were effective. So for the purpose of this study, then my first research question was, do academic women in STEM pursue motherhood at the cost of being a quote unquote great scientist? I operationally defined great scientist with outcome variables like salary and other benefits, promotion and advancement, scholarly productivity, job satisfaction, and retention in the academy or retention in the field of STEM. I then tried to look at whether I could find some moderators that might impact this relationship between motherhood and being a great scientist. Some of the moderators I conceptualized were institution types. So for example, like an HBCU or a teaching focused institution or versus an R1. Position type, be it a teaching position or a research position, how long someone's been in the position, their age, the gender of their partner or the gender of their co-parent, presence of some kind of critical mass in a department, maybe whether or not there were policies regarding family leave or tenure promotion at their institution. And then I didn't expect to find enough quantitative studies of motherhood in academic STEM to be able to describe how the impact of caregiving has differed by race and ethnicity. So because of that, I'm also conducting a smaller metasynthesis on this topic in particular. And that's my third research question, or what I call, I guess, research question 2 there. In what ways does the motherhood penalty, as summarized in the meta-analysis, differ once we disaggregate women by race and ethnicity? This project utilized a critical mixed method design as conceptualized by Metcalf and colleagues. Critical meaning self-reflective, justice-focused, attending to structures of power, and then mixed meaning looking at both quantitative and qualitative data collection and analytic techniques. So in my mind, meta-analysis and other quantitative summary methods are actually quite valuable for studies of STEM inequity, because they can help us to summarize a large body of literature, to try to generalize complex social phenomenon like bias. And quantitative studies, summaries of quantitative studies also sometimes help us succinctly communicate the impact of bias to non-scientific stakeholders, of which higher education administrators often are, or other government entities. But we also know that when researchers attempt to disaggregate equity data by social identity, think, gender, race, ethnicity, or income, they encounter small sample sizes that risk de-anonymizing and causing harm to those individual participants. So for this reason, I think quite thoughtfully, many quantitative studies and researchers of bias and inequity avoid either collecting or reporting these kinds of results. Unfortunately, they sort of do it entirely versus doing it carefully. This is despite the clear mandate, of course, from the NSF and others that research on equity and on social issues need to consider intersecting identities and contexts. Then in contrast, narrative and interpretive approaches are really consistent with our social scientists' goal of valuing the whole person. I'm at a Jesuit institution, so our phrase there is cura personalis, and caring for the whole person and all their identities. And we want to be thinking about the person and all their identities in the context in which they exist. And using these kind of narrative and interpretive approaches then therefore give better voice to the historically marginalized. So metasyntheses and other qualitative summary methods help us to avoid those pitfalls of aggregative summaries that can combine really heterogeneous groups into some sort of meaningless category, like women. Women actually have quite diverse experiences, right? Or maybe even to meaningless dichotomies like white women and non-white women. Unfortunately, though, findings from qualitative studies don't really lend themselves as easily to generalization, which is one of our key goals in literature summaries, and are more difficult to communicate to stakeholders. So for this reason, I included both quantitative and qualitative components in the project. In so doing, I hope to elucidate patterns on a larger scale, while also trying to contextualize or maybe even trouble the conclusions that are being made about all women or all parents in the quantitative literature. This is one quote here from the Metcalf article. A critical mixed methodological approach pushes us to acknowledge how past and present research, including our own, might be limited in accounting for those very experiences we seek to understand most in our efforts to broaden STEM participation. So really a call to sort of include all kinds of data. So in terms of my summary and search, I used very similar, though not identical, keywords throughout the search. I began with the keywords that are listed here: mother or parent or caregiver, baby, pregnant, birth family, and then tried to get at something related to STEM or science, and then something related to being a faculty member or professor. I did not search for specific dependent or outcome variables during this initial search. The vast majority of the studies that came up used the outcome variables I originally proposed and was conceptualizing. But intentionally not searching for specific terms allowed me to find outcomes that I might not have initially preconceived as related to being related to like success as a scientist. So just a couple examples, I didn't initially think about outcome variables related to mentoring needs and whether or not somebody's mentoring needs were being met. And there was also this really interesting dependent variable in one study that was related to like perceptions of working hard, how hard you think you're working. And as a psychologist, I think that is a really important variable, those sorts of perceptions. So this is a Prisma diagram, which you would see in any kind of meta-analysis project and many metasynthesis projects. And it describes this search screen and coding process. Here I'm showing the search screen and coding process for quantitative studies. So I did all of the initial literature searching within journals, large research databases, and libraries like the ARC library on Mendeley. And I'm certainly happy to talk more about the specific journals that I targeted and why I targeted them. Because my goal was to gather all relevant articles on the topic of academic motherhood and success as a scientist, I didn't really worry about duplicate results across journals or databases. These were cleaned later, or about being economical with my results. So this resulted, perhaps because I wasn't trying to be economical, it resulted in over 700 initial articles that were relevant by search criteria and article title. So I removed duplicates in Zotero. There's a duplicate removal function there. And then pre-screened based on a quick review of the abstracts. So my goal of the pre-screening was just to get rid of the articles that were sort of obviously irrelevant. So for example, some studies were about high school teachers, but maybe it mentioned college somewhere in there, the teacher's college experience, and so it was coming up in my search. I also kept my eye out for studies from the first round pre-screen that were relevant, but only included qualitative data, and I moved those into a separate folder in Zotero to start the metasynthesis collection. Then after pre-screening, the resulting list included 280 articles. I used Cooper 2016 to help with my meta-analysis methods and follow kind of the step-by-step approach there. And I had a couple undergraduate research assistants, which I'll talk about in a second. One of them, Caitlin, and I created a screening form based on the inclusion and exclusion criteria, which are listed here on the left. So for the meta-analysis, the study needed to be published within that last decade, but through the pandemic years. the study needed to take place in some sort of academic setting or include academic settings. So while industry was interesting to me, but I did not use that as an inclusion criteria. Participants needed to be faculty, or the sample needed to include faculty. The data needed to be quantitative, experimental, correlational in some way, and include an effect size. The study needed to include a variable related to parenting, mothering, or having a child in some way. It should either be only women and non-binary folks or include a gender variable. It needed to be about STEM, or the sample needed to include STEM fields. And then I had some additional criteria for the metasynthesis there. Rather than quantitative, it needed to be qualitative. It needed to have a variable about race, ethnicity, and it needed to be US based. And that was because I was trying to limit my conversation and context around BIPOC women in the way in which we define historically marginalized racial identities here in the US, and also then sticking with the definition of quote unquote underrepresented minorities from the NSF, which my colleague Sue Rosser in her other presentation really complicated for us. Then on the right there, that's just the meta-analysis and meta-synthesis strategy, which I've already talked about most of those things there in terms of where I used screening and which guidelines I used. So back to that Prisma chart from before, my research assistant and I screened articles in parallel, and then we met weekly to discuss and reconcile differences, discrepancies. We frequently needed additional information beyond the abstract to determine if we should include the article for coding. So for example, a lot of studies referenced parenting as a potential barrier to women's professional success in the abstract. So women may suffer from research productivity due to parenting. They might have said that, but then when you actually flip through the study, there was no variable about whether or not the participants were a parent or were not a parent. And so then that would have meant that the study was excluded. So in these cases, I scanned the full article for the missing information and then screened it in or out as needed. The most common reasons for exclusion are listed at the bottom right there, mostly that they didn't actually have quantitative data, or sometimes it seemed like it was an original study, but wasn't actually an original study, was covering a study of somebody else's. No parenting or motherhood variables, probably the most common exclusion criteria out there, not focused on STEM, and so on. During this time, I was also identifying articles via other methods like citation searching. So looking at the reference list for all the articles that we were screening. I was directly contacting authors to find out if they had published more studies than what I was seeing or had unpublished studies. And then we used the same process for screening studies that for these articles that came through the backwards searching and directly contacting authors. So through this process, we ended up with 79 total records to be coded, and using the full text of the articles and a detailed coding sheet for the study and results information. My research assistant and I parallel coded those 79 articles, and then we met to reconcile differences. 19 of the studies were excluded after reading the full articles, and that resulted in 60 quantitative studies coded for the current presentation here that I'm talking about and report in September. And I'll come back to those studies in a second. And then in parallel, I was doing sort of the same thing with the qualitative article. So this is the second Prisma diagram. This one is the search, screen, and coding for the qualitative studies. So as I was looking through the quantitative studies, I was just pulling out the qualitative ones as I could. But then I also went back and did a new search and screen just for the qualitative articles. And remember, based on my pre-project literature search, I didn't really expect to find enough quantitative data to examine the impact of motherhood on success as a scientist, how it varied by race and ethnicity. And so I didn't expect a lot of the quantitative articles to come over, but some did. Then we repeated the same process for the qualitative studies, like pre-screening for obviously irrelevant studies, and formally screening using the inclusion criteria on the left there. So to date, we've parallel screened 156 qualitative articles and met to discuss discrepancies. We still have 102 articles to pre-screen 9 articles to screen. So far, every single one of the qualitative studies has required gathering additional information, so the abstract is not enough. So I need to sort of read the full article in order to determine even if it should be included for coding. 13 studies are still in the process of full text review for inclusion. We currently have 23 articles that are included in our qualitative coding and thematic analysis. All of my initial search, screening, and coding was done without the use of automation tools. I am not sure I would recommend this approach, particularly given the high caliber and state of automation tools today. But I was really interested in quote unquote touching each of the articles to ensure that a metasynthesis or other relevant article wasn't missed or fell through the cracks. Doing it all by hand also helped me to identify background articles that were relevant but didn't meet maybe the inclusion criteria. Maybe it was a review of a highly relevant topic. And most importantly, this was actually my sabbatical project. So I wanted to be sure that I was kind of intimately understood every single step of the process for professional development purposes. I think if I was to do it again, I would now use automation, but I think I learned quite a bit by not using automation the first time. With regard to my research assistant team, the majority of the RA work was completed by Caitlin Medina. She's a double major in biology and neuroscience, so a STEM major, and Emma Barnes, who's an undergraduate psychology major, recently joined the project. One thing I really liked about working with undergraduates is that they're not academic experts on the topic, nor do they think they are academic experts on the topic. And so they're totally unfamiliar with researcher names and labs, and they really treat each study equally, which I appreciated quite a lot. It made it easier, I think, for them to screen and code the articles blindly. In addition, they have an outside perspective that's really free of jargon and preconceived notions about the topic, which just helped me question maybe some of my assumptions. And lastly, both students have lived experience that I do not, including one is a woman of color, Latina from the Western Slope here in Colorado. And so they could offer different types of insider perspectives on some of the topics. And of course, we've spent many a research team meeting discussing this frame in particular, like how do you be a scientist and a mother? How do you be a scientist and a mother of color, and industry versus academia, whatnot. So perhaps those of you who've been to the website and seen in my bio or in this advertisement for the presentation today, you would see that given the scope of this mixed method project, and also because I, like many parents last year, had a terrible respiratory season. So my little guy was in and out of the hospital and all sorts of things. And so I have reconceptualized this project, 1-year project, to be a 2-year project. So I feel like I'm doing quite well in the middle of my 2-year, but that means I'm not presenting final results here. I'm just presenting significant advancements towards the results. So I'm going to share with you some of what I think are the interesting findings so far. One of the central inclusion criteria for this project is that the study must include a variable related to parenting, mothering, having a child, whether that's biological, adopted, foster, step, or childcare responsibilities of some kind. So for the purposes of this systematic review, I relabeled any variable at all that was related to having or caring for children as parenthood. What I wanted to show you was the sheer number of ways that these researchers are defining parenthood. So you can see there's quite a lot of variability here. For example, some studies define parenthood as having children currently living in the home, whereas others maybe just merely ask participants if they were a parent. So maybe your child is outside the home or lives with a different parent, but you still would say yes to being a parent, without like sort of a definition or restriction on living situation. Others generalize their sample to a faculty member with quote unquote any dependent, which I think is quite interesting. Many researchers were interested in differential effects of parenthood by age of the child. So for example, what happens to your success as a scientist when you have young children versus school-age children? Maybe number of children, what happens when you have more than one versus 1 or 0? And timing of children, did you have your child pre-tenure or post-tenure for ranked faculty? And so then they categorize their predictor variables in that way. Others assess factors like extent of family care responsibilities or number of hours spent on childcare, which I thought was a clever way of trying to get at differential impacts of childcare and dependent care. Two unique outcome variables related to parenting included whether a participant endorsed having fewer children than they wanted because of their science career. So the question was, do you have less children, fewer children than you would have wanted if you had been in a different career? And another one was whether a faculty member took a career break or had another type of career disruption to provide child or elderly care. Given the focus of this project on gender equity, I only included those studies about parenting in which the data were either all about women or non-binary trans folks, gender minority folks, or the results were examined by gender. So maybe mothers versus fathers. So for example, if a study looked at whether parents published less than non-parents, but didn't separate their data by gender, or the parents weren't all women, then the study was excluded. All but 3 of the studies did not include non-binary gender identities in their sample. 2 studies combined non-binary participants with participants identifying as women, and 1 study had 4 categories: women, men, non-binary, or third gender, and their 4th category was quote unquote different term. A key goal of this project was to examine the ways in which parenting penalties might vary by race ethnicity of the women scientists, with particular attention to historically excluded women. As expected, almost all of the quantitative studies coded for this project did not examine the impact of parenting by both gender and race ethnicity. There were studies that examined the impact of parenting by racial identity, but then they didn't disaggregate gender, or they were not focused on women or non-binary folks specifically. And so then therefore they were excluded for the purposes of this study. 19 of the quantitative studies included participants from outside the US or were entirely internationally focused. Most of these academics were based in the European Economic Area, so Austria, Germany, Italy, Netherlands. Some studies included faculty from Japan, Philippines, Brazil. And most, though not all of those studies outside the US did not include an equivalent of a race ethnicity variable. 27 of the US-based studies either did not collect information on participant race ethnicity or did not specify one way or another that they had that information, so I couldn't tell looking at the study. But I would like to highlight that in contrast to research on academic motherhood from more than a decade ago, we did see almost a little under half of the US-based quantitative studies, including a race ethnicity variable for at least demographic description of their sample. I know that feels like not a big enough jump, but that is a major change from 10, 15 years ago. And some included race ethnicity for analysis, which I'll talk about, but often it was only as a control variable, that far right bar there, as you can see. 4 of the studies that collected information on race ethnicity dichotomized the racial and ethnic groups into white and non-white, or some of them used the phrase white and all others. There were 2 quantitative US-based studies that did include analyses of parental impact by gender and race ethnicity. And when I'm talking about specific studies here, I'm just going to use my code numbers instead of the author names. And that's just to help not weight one of them for you more than another. But they're all listed in the report on the website by number. So study 79 examined work-life balance by a variable that they called household status. So this was whether or not you were married or single and with or without children. And they found that Asian American mothers and fathers, so all Asian American parents, were more likely to report being able to, quote unquote, find the right balance between professional and personal family life than Asian American non-parents. So that's interesting finding. There were no significant differences between parents and non-parents by gender within African American participants or within Latin A faculty. Study 52, the second of those 2 studies that included race ethnicity, only had African American participants and European American or white participants. They did not examine parenthood specifically, but they did find race and gender differences on the self-rated importance of policies related to childcare. So I included it because even though they didn't look at parents specifically, they were looking at views about policies related to childcare, elder care, quote unquote, stop the clock, policies for family responsibilities, and other kind of modified duties. And in each case, they found that Black women's ratings of importance were the highest, though all participants rated them as important. So I think the summary here is just that my third research question about the impact of motherhood on success as a scientist, disaggregated by race ethnicity, will clearly need to be answered in the systemic review of qualitative studies like we would expect. So let's see. The remainder of my comments about quantitative studies will just be about those articles that examine the impact of parenthood on success by gender, or for whom the entire sample was women, trans, non-binary, and regardless of whether or not they included a race ethnicity variable. In a typical quantitative summary, the goal is to collect effect sizes and combine them across similar studies to get a sense of the overall effect in the population. This process allows you to weight study factors so that like the strongest studies count more. And you would do this using Pearson correlations, odds ratios, and beta coefficients. But as is common in social science research, I found that most of the quantitative studies of academic motherhood utilized complex regression equations. And unfortunately, it's really difficult to combine individual beta coefficients across these different models. So I just wanted to give you a quick example of that. So here, for example, Feeney et al. Feeney et al. Regressed journal publications, which they defined as self-reported number of peer-reviewed articles on a variable they called married with kids by gender. Another study also regressed research productivity. They calculated that by dividing researchers' quality adjusted and co-author adjusted publication output by the number of years since the researcher first published an article, so very complicated, dependent variable, on a dichotomous children variable, yes, no, by gender. So leaving aside that we have very different definitions of parenthood, the other variables in the regression model are different, and therefore the extent to which our predictor of interest, in this case parenthood, can explain variance in journal publications is also quite different. The model in the first study includes covariance like faculty rank, STEM discipline, presence of on-site childcare, whereas the other study includes variables like age and whether the researcher had formal mentoring. All are important, but it just means statistically I have a difficult time combining those beta coefficients. So for this reason, I modified my planned meta-analytic strategy to still calculate average weighted effect sizes when possible, but more commonly to just provide a descriptive summary using effect sizes. So to provide you with a basic descriptive summary today, I included a vote counting table for the most common outcome variables in the quantitative studies that have been coded so far. So in my case, the predictor variable is always parenthood and academic STEM and by gender. The outcome variables are related to success as a scientist and then are going to be in the first column here. So research productivity, salary, job satisfaction, mentorship support, work-life balance, retention and advancement promotion. And then study results are divided then across the remaining columns by the groups being compared. So you can see on the very top there, mothers versus non-parenting women, fathers versus non-parenting men, and mothers versus fathers. Vote counting tables just simply state the direction of the finding, higher, lower, or non-significant. It's a single vote. So keep in mind that vote counting does not weight studies by strength of effect size or how representative the sample is or how strong the study is, any other measure of study strength or quality. So in other words, not all votes are equal, but in a vote counting table, they look to be equal. In addition, the non-significant findings might actually be quite interesting because they might show a direction of a result that's unavailable to us in a vote counting table because it'll just be shown as non-significant. And each vote is not necessarily a unique study. So for example, study 11 found down in the retention category, that new mothers were more likely than new fathers to switch from full-time to part-time STEM employment. They were more likely to leave STEM employment for non-STEM employment, and they were more likely to leave the workforce entirely. These are 3 separate findings, or quote unquote votes, all in the retention category. Interestingly, that same study found that both new mothers and new fathers are more likely than their childless same-gender peers to leave full-time STEM jobs in academia for full-time jobs elsewhere. So the last point I'll make there then is that vote counting doesn't take into consideration that multiple results are from the same study, right? They're non-independent samples. But we can use this vote counting table to at least think about some potential implications or insights from the quantitative studies. So at first glance, at least, preliminary results from this summary suggest that this narrative of child penalty may no longer be quite as clear as it once was, at least when academic women and men are aggregated across race, ethnicity, and when genderqueer participants are excluded. It may be that there is still a parenting penalty, so that's like the pink or purple columns, or a gender penalty, the turquoise column, but without an interaction between the two. And that is just to say that there were many non-significant interaction findings. There were also many non-significant main effect findings. For example, across a small sample of studies, the results suggested that the gender effect in salary still exists, meaning that women are paid less than men, but it's stronger than a parenting effect. We don't really see a difference in salary between mothers and non-mothers, for example. When studies do find a negative impact of parenting, it tends to be greater for those in STEM versus non-STEM, so versus humanities fields. And the negative impact tends to be greater for parents with young children versus older children. This is probably logical in that it takes more time to care for young children. One study also found that parents of younger children have the subjective experience of working harder than those with older children. And like I said before, I think that's a clever outcome variable. Despite an overall lack of interaction between parenthood and gender, these analyses do suggest that researchers still find the amount of child-independent care provided. So for example, being a primary caregiver versus a secondary caregiver matters, along with factors like marital status and occupation of one's partner. All of these are gendered factors, even if they didn't examine them by gender. The impact of parenting on scientist success also varies by country, which is probably unsurprising given the dramatic differences in familial cultural expectations and policies by country. It should probably be unsurprising to you too to know that there's still quite a lot of stigma and fear related to taking parental leave in some countries. Study 37, which was a US-based study, also found some evidence of stigma here in the US, that faculty were more likely to utilize parental leave after the birth of their first child compared to their second or third child, as if parental leave is only for the first time you have a child, and after that you don't get it again, quote unquote. And the participants described the reason for not using it as stigma related. Of note, one place where I've generally not seen a parenting main effect is on career satisfaction variables. Parents and non-parents seem to be equally satisfied or unsatisfied with their careers. Other studies do find some interactions with caveats. Let's see. Study 38 showed a greater negative impact of parenting for women than men, but only for those women, I think I have this here, yeah, but only for those women with what they called low academic achievements, meaning few publications or grants. So the authors suggested that we interpret this finding to be a result of less research, quote unquote, momentum for these women, like going into pregnancy, going into birth. And so then therefore there'd be less ability for the research to continue on while by like their large, highly productive research labs while they're gone. Or perhaps the greater negative impact is due to like a lack of external agencies holding researchers accountable. What they mean here is that there's a lot of evidence that women publish more when there's an external agency demanding deadlines and things of them. Similarly, another study found research productivity to peak at childbirth in their sample of women economics professors. And the authors suggest that this just might imply that already successful women academics have children, and that women researchers wait to have children until they believe they can, quote unquote, take the hit. which I think I would say passes the smell test. I think that makes a lot of sense. As mentioned earlier, retention in academia and in STEM is one of the few places where we do see ongoing gender-parenthood interaction effects. So taken together with the findings I just described, we might imagine that mothers who stay in STEM are qualitatively different from those who leave in really important ways, like maybe they have more support or are already highly productive. Another place where gender and parenthood seems to interact is in studies of COVID-19 pandemic effects. Even though my review only included studies through 2022, plenty of articles have already been published on the impact of COVID-19 by that point. Consistent with mass media reports, the literature I reviewed was very consistent, found that pandemic impacted people, of course, professionally, and that impact varied greatly by parenthood. It appears to have been bad for parents' productivity overall, and especially for mothers with small children or multiple children, and in terms of an interaction, good for the productivity of non-parents. Here I have some photos from Anna Cohen-Miller's study of international academics who identify as mothers. She refers to them as mother scholars, who submitted photos of their pandemic experience from May through July 2020. And just in the interest of time, I'll direct you to her website, which is in the top right there, to check it out. But it's super interesting, some of the quotes of these women about what it was like for them to try to be a scientist while at home. Okay, so as was made clear in my kind of preliminary analyses of quantitative studies and the importance of critical mixed method studies, the most important next step is going to be thematic analysis of the qualitative data. This will help problematize in important ways conclusions that we're making with this aggregated women category or parents category. And I'm just going to give you a few kind of teasers of where we are right now. I picked a Lego puzzle picture here because for me, Legos is synonymous with parenting, or perhaps stepping on Legos is synonymous with parenting. Rainbow with browns and blacks, some are intertwined social identities. And then the puzzle here, trying to put together the pieces when studying intersectional equity. I think one of the most important take homes here is that there's all from my qualitative coding that I've done so far is that there's already evidence of cumulative disadvantage for BIPOC mothers in STEM. And this is probably not surprising to you. So what I think we'll do is we'll just use one outcome variable as an example. Let's use retention as an example. What I just showed you was a quantitative finding that parenting women leave academia for industry or leave STEM because of increased flexibility and decreased hours. What we're going to see, what we've seen from the qualitative research, is that this is probably more common for BIPOC women due to what I'm calling here a greater push out of academia. So for example, BIPOC women often report really terrible experiences as graduate students, BIPOC women in STEM, explicit and implicit discrimination, being left off posters and papers, bias in grading, things like that. That's going to push folks out prior to ever becoming a faculty member. And then in terms of stories of parenting women in academia as faculty, the BIPOC women report experiencing more distrust of their chair and colleagues. There was a chair who literally was looking into the office of a woman to make sure she was there doing her work, devaluing or minimizing scholarly accomplishments. One Black woman, associate professor in engineering, said, "I would be an endowed professor by this point, objectively," looking at, her CV is what she meant, being excluded from informal networks, explicit discouragement from using family leave. So if we think about this in terms of, say, productivity or promotion and advancement, we may not find a difference in publication rates by parenthood status, or if we could disaggregate by gender and race, because BIPOC women are working double hard. So it's there because they're working twice as hard to hit the same sort of bars. But we might find a difference, say, in promotion because those same research outputs are being undervalued. One study also talked about Latinas in STEM and leaving academia for industry because of the potential for greater pay that provided more financial stability, and listed that as more important to Latinas than other ethnic groups. And one woman I'm thinking about was talking about the responsibility of paying back her family members, her mother in particular, who took out loans so that she could go to college. Okay, so I'm going to end here with just some implications. I think folks in higher administration are really open right now to the topic of working parents and gendered racism in the academy. So my first suggestion is just going to be to continue doing the longstanding, well-documented policy changes that we know about that are working. That may be why we have some non-significant findings. We just need to be continued vigilance for those. We should probably fine tune some existing policies. For example, make sure our family leave policies are for all types of care responsibilities, not just for parenting, and parenting in all of its forms. And then there were some really interesting ideas related to how to broaden, for example, the idea of like service and rank and tenure. We see BIPOC women being much more interested, reporting more interest in activism and working within their communities. And how can we value that in a rank and tenure sort of system? And I'll just finish by pointing you to an upcoming report from the National Academies of Sciences, Engineering, and Medicine, not up yet, that is going to list these policies and practices that I think will be helpful for everyone. So thank you very much. As promised, here is a picture of me and my child.
Wow. Thank you so much. I'm very interested in responding to the couple of questions that we have. And, just to say too, this is, as you mentioned, personal for me and political, especially in the context of things happening. But I wanted to use this time to respond to a couple of questions that we have in a chat. One was overall method or approach question. Liz Kellermeyer asked, did you work with a librarian for your searching?
Oh, that's a great question. I did not work with a librarian, but I can see the real benefits in doing so. We, like all universities, are in a current budget crisis, and we cut our library's budget by 40% this year. And so we lost subscriptions to the research, to the databases for which we had not already paid. At that point. And so just thinking about how to do this work in the middle of a budget crisis is interesting. So for me, really relying on interlibrary loans, and actually I can literally remember emailing Sue Rosser, the other VPS and from San Francisco State, and saying, can you get this article for me? And then she would send it to me. So using our networks in all the ways.
Mm-hmm. Joya Misra says, isn't there more stigma in countries like the US that do not have a federal parental leave that both men and women take? It's hard to know what countries are in your sample, but stigma tends to be much lower where most people take leave, especially where both men and women take leave. Do you have any thoughts to share on that?
Yeah, thanks for sharing that, Joy. I think you're right, and that in some countries it is less stigma, particularly as the amount of time is greater, and as we know that people are more encouraged to take it. And I am drawing a blank from the exact study that I'm thinking of that had the number. So I would hate to be quoted here, but I believe that some of the participants in Japan, some of the participants in Brazil, talking not about, but in terms of European Union sort of countries, I think you're right that we in the logic there, to the extent to which stigma is lower, people should use these policies more and more equivalently, right? I do have a couple colleagues from Germany who've talked about that the pressure to not have children in the first place as women, German women, not that you can't use a policy, but that it was sort of frowned upon, that you need to either decide between having children or having a career. And so perhaps the pressure is coming earlier in that sense.
Wow. I'm going to pivot really briefly to a question that we have in the chat. How can we find out more about the existing policy changes relevant to issues of parenting penalty use discussed? And that comes from Valentina Dimitrova.
Okay, so sources of policy changes.
Yes. How can we find
Yeah.
out more about the existing policy changes relevant to issues of parenting penalty you've discussed?
Yeah, I think that the National Academies report is going to be highly relevant here because it should be a summary of what's been done policy-wise, as well as the impacts. But I think it's I'm thinking of the survey that they sent out to folks, just asking everyone to say what are the policies on your university, on your university campus, and what do they exist, how do they exist nationwide. So I think that might be a really good source, and hopefully that's soon.
And we have time for just one more before we close. Daniela Fernandez asks, would you say that it is important to look at the different disciplines or how STEM was defined? She also said, or they also said, thank you and such an amazing talk.
Thank you. That's a really great question. And I desperately wanted to look at the disciplines within STEM and could not find enough of a breakdown. Most of the studies were STEM versus non-STEM, or within STEM looked, there were many that looked by discipline, but not also by gender and discipline, or by gender, race, ethnicity, and discipline, or parental status and discipline, right? So there, I do think it matters. It matters culturally, right? The cultures of these fields, many of those qualitative studies I was just talking about with the terrible experiences, many of them were in engineering, for example. And we know that critical mass is different, like, for example, in the biomedical sciences, and in the healthcare fields. And NSF does include healthcare and medicine. The second M in STEM is often medicine. And I do think we see differing biases in that STEM field, for example, than some of our more traditionally masculine coded STEM fields like physics or math.
Mm-hmm. Well, I feel like we could have this conversation for days and years on end. Yeah, I think we didn't even really get to speak to, given how many women there are in these spaces, and non-binary folks, mothering people in these spaces, parents in these spaces, that there are just so few. What came down to be so few usable resources and things like that for your study, but um, I just have to say that this was such an incredible question to try to respond to, especially in the context of meta synthesis and meta analysis. And we're so grateful for you for being a part of our virtual visiting scholars and for what you've shared. I did share in the chat the link to Erin's report. And also just want to say thank you to Erin and to Sue, to our fifth cohort, for their amazing work and their contributions both within and beyond the Virtual Visiting Scholars Program. And to thank our attendees for joining us today. We do have a couple of announcements before we head out. First is that we would love for you to complete the ARC Network Community Survey, as this is just an amazing way for us to hear from you about your experiences and being a part of our community and doing this work alongside us. Your input is absolutely critical to the work that we do. And so we ask that you please consider taking the survey. And to just sweeten the deal a little bit, those who complete the survey will be entered for a free registration to the 2024 Advanced Equity and STEM Community Convening, which will be held in Baltimore, Maryland. I also want to share that the call for proposals is open for the convening, and we'd love to hear more from you and hear more about the work that you're doing. So please also see information for the call for proposals in the link that we have added to the chat. Also, this is a really difficult time, even though we can say that so much of what we're observing in terms of anti-DEI efforts are nothing new. However, it has absolutely reached a space where we wanted to bring together our communities to host a town hall and have a broader discussion. So on February 15th in 2024, WePan, the ARC Network, Cooperative Agreement and the Access Plus Grant Initiative, will host a town hall to discuss anti-DEI efforts and how we can support our communities who are working to advance equity. More information for that is also available at the link shared in the chat. And with that, we hope that you have a great rest of the week and a restorative weekend. And we hope that the close of 2023 is a time that renews and rebuilds us all. Thank you again so much, Dr. Winterroud, and to all of you for joining us for today's talk.